So initially, it's almost a year since we started. We're working. It's like 12 months of intervention we've been working through. So Hashimoto's hypothyroidism is your number one complaint. Anxiety, we diagnosed with Hashimoto's, insomnia, episodes of depression, extreme fatigue, brain fog, body zaps, muscle weakness, neck pulsations, and very low blood pressure. And just before we start, I know you said you would um, were working with your cardiologist to do a cardiac workup. Did they find anything?
So I had cardiac blood work. I thought I sent that to
Not the blood work, but they were doing evaluation.
well, no, I've had that in the past. I have a loop recorder. Um
Yeah.
uh they told me I had AFib, but I actually just switched cardiologists because when my husband got cancer, my cardiologist, you could never get any, I couldn't get my blood work from him, I couldn't get anything from him. And every time I would call, nobody would return my calls. So my husband had to go get an echocardiogram, and the lady from our soccer team works for a cardiologist. So he went there, really liked him. So I saw him last week, and they scheduled an echocardiogram for me on February 15th just to check, because
Okay.
I have a hole in my heart, a small hole. Supposedly I have the AFib, but he wants to review the records. I have calcification, I have plaque in my valves, just regular things. So my endocrinologist believes that the AFib was caused by the armor thyroid I was on. So she switched me to Tirosint. And I don't notice the heart palpitations as much since I've been on Tirosint. So that hasn't been as big of a problem.
Okay.
But yeah, so far, I mean, he says I'm good. He did, and I didn't start taking it because I wanted to talk to you. He did recommend a low grade statin. He said it's up to me if I want to take it, but he would suggest it. But cardiologists have been telling me for 10 years to take a statin. I have high cholesterol. Um, but it's like 17, it's like 217. It's not excessive. So he did say that some of the benefits of a statin are also the plaque that I have, 15% plaque in my arteries. He did say that it would help with the plaque, but this doctor didn't really push it on me. He prescribed it, and he said it's at 10 milligrams, and kind of said I'm borderline for him. So I
Right.
haven't started it.
Yeah. I mean, ultimately, every person has to make their choice, cost benefit analysis, and there's for us, we've been working on so many other things. Like we're not even there. We're trying to just get you to be out of pain, get you out of function. We're not even looking at cardiovascular risk
Yeah,
analysis.
I'm just not a big medicine taker. So
Yeah.
it's just like to take a medicine that I'll have to be on for the rest of my life. It's kind of like, but I also don't want to have a heart attack and die. So, so it's just something
Yeah.
I have.
I think either way, just let me know what you want to do, and
Yeah.
then I can try to make sure as we work on your diet, nutrition, lifestyle, we can take that into account. And
A lot of those things you just listed though are much better.
okay, so let's go through that. Since your last appointment, which parts of your treatment protocol have you followed? So eliminating sugars by 90%. That's fantastic.
Yeah.
First thing in the
Been
morning.
really good on that. I
Okay.
eat first thing when I wake up in the morning, like you said.
Okay.
I usually eat every 2 to 3 hours.
Great.
And I was taking that. I haven't I ran out of the supplement. So the supplement for the sugar imbalance before the meals, I have to order more of that. But I took it, I would
Pro,
probably say I took it 70% of the time.
that was the
I would-
pro-glyco
Yeah.
SP. Yeah. Okay.
Yeah.
And that's just nutrients and minerals and things to support the adrenal glands and so forth. Okay. That's fine. And then which parts of your treatment have you not followed? Complete elimination of sugar. Okay. No longer taking piano lessons. Okay. Sometimes oversleep. All right. Those are not that big of a deal.
Yeah.
This 10% sugar part can be important depending on how you define 10% and what that 10% means.
It's usually an apple. Like if I'm running out of the house and I don't want to skip a meal, I'll grab an apple.
Okay.
Or in the morning, sometimes if I have some bacon or whatever, sometimes I'll have half a banana. It's usually fruit.
Yeah, the half a banana is not, it's terrible for your blood sugar. The apple isn't so bad because the banana is so concentrated, so high glycemic. I don't know, we're trying to get you out of that roller coaster, right? And then you start to crave sugar more when those things happen.
Yeah, which I don't do anymore. I did used to crave sugar after I eat, and I don't do that anymore.
Yeah, yeah. I remember when I did the initial workup on you, we're really concerned about excess fruit consumption. Like you were eating a lot of fruit. You were like a
So,
fruit
yo,
junkie.
I was eating a whole bag of grapes a day. I was eating pineapples and water. I mean, that's all. I was practically living on sugar
Yeah.
or fruit.
So banana, banana's not that, apple is not that bad if you're just having here and there. The concern would
I
be,
mean, if I'm at a birthday party, I'm gonna have a small piece of birthday cake. Like we're talking, that's where I'm saying I haven't eliminated
yeah,
sugar.
yeah, that's not bad. Okay. That's no big deal. Okay. So I think it sounds like you're pretty good there.
Yeah.
You notice a difference those days where you're like limit your
I
sugar?
do. I do notice a difference with the sugar. And the major thing I want to get through this and answer your questions, and then I'll tell you what I'm having the major problems with. And I don't know if there's so much sugar imbalances as maybe hormonal.
Yeah, I saw you were really concerned about the hormonal stuff.
Yeah.
Yeah, we'll go over that for sure. Okay.
Okay.
Um,
My
but
piano, my
that's
piano
good.
teacher stopped giving lessons, and so I was doing it with a guy online, and I just can't learn that way. It's just not. It's a mental block.
Yeah, just find something to keep your brain active and happy. Even
Yeah.
more so now that I saw your MRI report, which we'll go over.
Oh, great. Okay.
All right. Okay. Do you have any new persistent symptoms? Okay. So I guess we can talk about it now. Extreme weakness, soreness and strength of legs, knees, back, shoulders and hands, facial numbness, pains in the left big toe that radiates up the left side, dizziness when looking to the side and down, walking with fast heart rate and feeling of slowness. Okay.
Okay, so this isn't this right when I wrote this. What happened? Hush. Sorry, my dogs are in here. They're getting groomed, and the groomer just cut my dog's tongue. So that was a whole thing before I even got it. So anyway, so my son's handling it. So what happened was just right after Christmas time, it was really, really weird. My body was aching for like 2.5 weeks. But I mean, to the point where if I was sitting on the couch, I didn't even want to get up and walk. Everything hurt. My back, my bones, it just aching. And I was waking up in the middle of the night, which I still do, but not like this. And it was like my husband would run and he would get the blood pressure machine and we would do, and everything just felt like it was slow. Like my thinking was slow. My breathing was slow. It was just like the world just slowed down. And this went on for about 2.5 weeks. And then that's what I was saying. I don't know if maybe I was having a flare up because of the holidays and the stress or whatever, but it slowly went away. So that hasn't been happening, but my body is very sore. Not like this. So I've been having a lot of problems with my hips, which, my hip is bad, my knees, and then my lower back. And that is why they gave me the MRI. But it's not like this. Now, the biggest complaint I have, the only thing that I can't figure out is I'm still waking up probably 4 nights out of 7. I go to bed and I still wake up. It hasn't been as bad where I'm feeling anxious, jittery, can't sleep. And I have really been trying to keep a journal of, okay, when did I eat? What did I eat? What time did I eat? And it doesn't matter. I can have not eaten from say 6 o'clock was my last meal, no sugar. If I take my vitamins after 3 o'clock in the afternoon, if I eat right before I go to bed, it doesn't matter what I do, it's still happening. And I don't know why. So I did just get my endocrinologist just called today, and she wants to lower my tirosint because she says I've swung hyper. So that could have something to do with it. Another thing that was weird is my cycles I've always been very regular on my menstrual cycles. The last 3 months, they come later. So this month I was like almost 45 days. I thought I was starting this process of menopause, and I started my cycle. So I think with the combination with the hyper and the hormones, I think that's but it's always the same. And it's not 3 o'clock like it used to be. It's like, I'll go to bed, hour later, I'm up. tossing and turning, can't sleep. And then I'll eventually fall asleep and then I'm fine.
Okay. All right. There's a lot there. So let's go through it. Let's go through it one. So, the big picture for me, and then what's new, and then what kind of adjustments we need to make, and so forth. The last time we talked, it was like, listen, Nicole, if you don't stabilize your blood sugar, we can't get rid of some of the smoke screen.
Mhm.
There's too much going on here.
And I've really, really, really been working on the blood sugar.
You definitely have done a great job.
Yeah.
And how long would you say you've been able to follow this consistency with doing such a great job? How much time has it been?
I think, well, so we saw each other and then my husband got diagnosed. So that was pretty stressful and I didn't take care of myself at all, I'll be honest.
Yeah.
I wasn't my focal point. I think probably November, I started to really focus.
So good solid 2 months.
It's been a good solid 3 months, yeah.
3 months? 3 months or
Yeah.
2 months?
November, December, January. So
about 3 months. Okay, I'll say 3 months. Okay.
yeah.
Well, that's good. You're gonna get some really good recovery.
And I feel better. I do feel better.
Okay. So that was like, okay, so the main things for me when I was like working up, trying to figure out what's gonna for sure you have osteoarthritis, degenerative joint disease in your hip. Like that was as clear as could be watching you walk. Did some orthopedic test and like there's no movement there, it's just stuck. And then your past MRIs of your neck showed degenerative changes all throughout your neck, and your recent ones are showing degenerative changes in your low back, meaning just like aging, osteoarthritis.
Yeah.
You're 52, right? How old are you?
52. I just turned 52. They did yesterday because the my doctor had called for, after seeing my other MRI, she called for a cervical spine. The insurance denied it. So they're appealing it. And so she took x-rays of my spine yesterday, of both my knees and my hip. She did that yesterday, so I don't have those results.
No, the results yet. Okay.
And she wants me to see a neurosurgeon to confirm, to confirm that I don't know, I have some weird thing in the back where it's not fusing. I don't know. But I'm not going to have back surgery anyway, so there's no reason for me to,
Okay. All right. So here's your low back MRI of the lumbar spine. Okay. And basically they're not finding any. So with the spine, like when you have like nerve pain or sharp pain or stabbing immediate pain, things like that, you're worried about any kind of compression of the nerve roots. And that can happen like what they call centrally in the central spinal cord, or on the outside as they come off the spinal cord. You don't have any kind of stenosis or anything like that. You just have mild degenerative changes all throughout your spine. But the canal,
which is normal with my age, right?
The word normal, it's not the right word. The word common. It's not normal. The points right there. It's not normal. It's not ideal for someone like 52. To me, is still young.
I think so too.
So I don't know why in the world they would call some of these things normal for your age. Because I can tell you, in my 20 plus years of practice, this is not what we see in 50-year-olds.
Well, and that's the thing. If I had to give you my major complaint besides the sleep thing, it's that when I sit, like even in a restaurant, if my husband and I go out to eat dinner, when I stand up, I have to walk really, like everything is so stiff and hurts. I look like I'm 90 years old. It's really embarrassing, actually.
I watch your gait analysis. You do walk like you're.
It does.
Like
and my knees now, when I go up and down, because we live in a 2-story house, I have to hold the railing. I can't walk downstairs one at a time. I have to walk down one step at a time like that, because my knee, it just hurts my knees and my hip. So that, if you want to know, my major concern is the thing that frightens me the most. I don't want to be in a wheelchair. I started back up with my personal trainer because we had taken a break when Mark was doing all this, and then he was out of town. We actually just are in the process of converting our garage into a gym.
Nice.
So I'm glad about that. So I've been walking with the dog. I've been doing more of that. And yeah, when I'm done, does it really hurt? My legs hurt? Absolutely. But I feel like the more I walk, the better it is for me. Because I don't want, when I'm still is when I start to stiffen up. So I have been doing that. There was one other thing I did that I was going to tell you in my memories.
Well, you did get screened for rheumatoid arthritis with your lab test.
And I didn't have it, so that's great.
Yeah. So they did, the typical screens you'd see with joint connective tissue diseases.
Oh, I know what I wanted. I forgot to write on there. And this hasn't happened in a couple weeks, but it was happening all the time. I was getting these sharp pains in my big toe on my left side, just my left side, just my big toe. I mean, like sharp pains, and that happened for a couple weeks too, and then it went away.
Yeah,
But I always have pain in my my
I read
lower.
that, and I was wondering if you had like a gout flare up, and I looked at your past lab marker for uric acid. It was never high.
Yeah.
Um, it's
The
possible. It's
the
hard.
doctor did tell me to wear compression socks because I did have some fluid in my ankles. So he told me to wear compression socks.
Sure. Okay. So a couple things. Like when I examined you and I did a workup on you, one of the things that was clear in the exam is you had something called hyperalgesia, which means you have increased perception of pain. So I took that, I don't know if you remember, but I took a pinwheel and I stroked your skin and I'm like, hey, tell me to stop feeling it. And like, oh, after 2 minutes, we just said, we give up. It's not that's not normal. Because you
Yeah.
kept feeling it for 2 minutes. And that's,
I do notice I have that still.
yeah, those pain fibers are really firing like crazy on their own. And it wasn't specific to just like one limb or an injury, it was like your whole body. So it's like systemic. So when we
Yeah.
see hyperalgesia, like only in one part of the hand or one specific nerve root, we know it's like a mechanical injury or something like that. But it's the whole body, then we know it's metabolic. Okay. Now, that type of increased pain perception can be caused by many things. And one of the main things is just like constantly increased spikes of stress hormones, catecholamines, which we were trying to first dampen with you stabilizing your blood sugar levels and to see what effect on the pain it is. So I think you've done a pretty good job getting your blood sugar stable. Obviously, you need to continue being persistent doing that because your adrenal glands and your pancreatic feedback loops with your blood sugar stability is going to take more than 3 months to restore.
Yeah.
Okay.
Yeah.
So you just have to stay consistent there. And I think you will have some improvements. And then also when we did your neurological screen, you did have antibodies to myelin. So there's some inflammation against nerve themselves. Okay. And that isn't specific for nerve pain. I mean, it can be peripheral. When I did an exam on you, I didn't see any signs of what we call neuropathy. There's like a small fiber neuropathy, long-term neuropathy. In the physical exam, none of those indications were there of that. It's just you had this hyperalgesia all over the place, which tells us that it's metabolic. Now, when we see that, we also look at foods. And one of the things you put in there is you notice like you can't do, I'll show you. This was like, wait, what's happening here? This is not a good sign. It's like a red flag. It was when I was reading through your emails, you posted milk. Like you can have.
I can't have dairy.
You definitely can't do milk, but you notice that maybe a little bit of cheese is okay.
Mm. Cheese doesn't seem to bother me as much, but I don't eat a lot of it. But when I have milk,
Well, it bothers you. You just don't know it.
yeah.
Because you have off the chart ranges of milk protein reactivity.
Oh wow.
Every single protein from milk.
Oh, eggs too. I
Yeah.
don't know if eggs bother me though. Huh.
Listen, these things can cause reactions 3 days later. So I don't know if you're expecting to eat cheese and all of a sudden have pain right away. That's not going to happen. You're going to have it in your system, and those immune inflammatory reactions are going to stay inflamed for days and days, and maybe 2 or 3 days later, and then they just persist, and then you get another little bit of cheese and another little bit of cheese and a little bit of cheese.
Then it does it again. And I notice if I don't stick with my same things that I eat, which isn't good, I notice if I differ, I immediately have gas. I immediately am bloated. I immediately have heartburn. I immediately have digestion. What did I eat the other night? Mark and I went out to dinner. It was our date night. We went out to dinner and it wasn't even bad. I had salmon and something. And when I came home, I had indigestion the entire night. Must have been the sauce or something that was on the salmon.
Okay, let's first connect a few things. I think you're connecting a food being an issue for you if it causes an acute symptom of indigestion and heartburn, all that.
Yeah.
That's not
it. Oh.
That's some of it. Okay. But you're chronically inflamed. Let me put it this way. You don't have autoimmune disease of your joints from your lab test. We don't see any indication of that. You, without question, have osteoarthritis, degeneration of your joints. 52, that is really severe.
Okay? I'm scared. I'm very frightened over that.
That's inflammation. That's systemic inflammation. Your whole body's inflamed. when we just touch you with a pinprick, your whole body's inflamed. So when you see chronic inflammation like that, you got to look at foods as one of the triggers, because dietary proteins can cause low-grade persistent inflammation. Milk being probably the most significant one traditionally with people.
Eggs. I
And
didn't realize
and even in
eggs.
the last time we talked, you're like, yeah, we had to go out of anything. I know there was cheese on this and there's cheese on that. And I'm like,
Don't
Nicole, you
eat
can't
cheese.
eat cheese. Okay.
Yeah, I
So
don't really eat cheese any much though. I really don't. Like maybe the last time I had cheese is I had eggplant when we went out to dinner and I pushed a lot of the cheese off for my daughter's birthday. I really try to
see the
stay away
terms
from
you're
it.
using, I pushed a lot of the cheese off.
I know I didn't push it all off. Yeah. So I need to start pushing all
Yeah.
the cheese
It's the
off.
same, it's the same like discussion. Gonna make these connections for you because it's keeping you inflamed. Like I think
Okay.
it took us a long time to finally have you like figure out your blood sugar stability. Sounds like you're doing a really good job with that. Like this milk thing, this inflammatory protein issue
No
is
milk, no dairy. I have to
yeah,
be dairy free
listen, you
completely.
have to be dairy. Okay, let's look at this list together. Okay.
So do I start so I need to start looking at the ingredients of each thing I eat and make sure that there's no egg or milk in there.
Yeah.
Okay.
Is that not clear?
Yeah, well, I
All right. So you can't do gluten, right?
yes,
And you are 100% gluten free.
yes.
No, you're not.
No, but I will be now.
Okay, okay.
Yeah.
All right, listen, this is what could be keeping you in pain, and this would be destroying all your joints. Like if you say like, oh, I don't want to be crippled, I don't want a wheelchair, then I would say, then act like it.
At all. Okay. I need to start looking up every time I put food in my mouth. Does it have gluten? Does it have egg? Does it
You
have
almost need to like you're at the point where you also need to just go grocery shopping and only have those foods in your house and know what your meals are that
well,
day.
and I did that before. That's when I lost the 40 pounds and I felt so good. I've done it before. I just haven't been as strict this time and I have to. So
Yeah, for
I
sure.
have been so much better, but I'm not 100% no.
I think you got one of your main layers, your just chronic blood sugar issue improved. I think you still have a lot to gain there, but I think your dietary protein inflammation is still a persistent issue. And it will deteriorate your joints and it will cause chronic inflammation. It will cause you to feel pain all the time. Like
Huh.
you got to reduce that load, okay? I mean, I can't tell you case after case of patients who find out what foods they react to and they go on a strict diet and
They feel better.
feel better. And then
Well, no, and I know that because I know before when I wasn't following what you were saying and I know that it was different. Like these, I think the pains I'm having right now, I think are just age with the bones, like you said, because of the inflammation. But when I was going through, I think it was my hands hurt and I know what you're talking about because I could feel it. That's when I have the pains in my chest and just the weird stuff.
and the thing too is like when you have pain in your joints, you'll have greater pain if you use those. So like if you had were lifting boxes or doing something heavy, then your clavicle and rib joints are going to be
Yeah.
more prone to be inflamed. If you were lifting or doing a lot of things with your hands, your hands could be really cramped and swollen because you already have a pre state level of high inflammation. So when you start to use it, it's just going to be really activated.
It is. I have no strength in my hands anymore.
Yeah. Listen, you're 50. You're going the wrong way. Like
No, I know.
your joints
I know.
go back.
Yeah.
They start to fuse together and everything. Okay. So wheat.
What's that alpha gliadin? What's that?
Remember, these are just different branches of wheat. All this tells us is
Oh,
you're for sure reacted to wheat. Alpha gliadin is the most common reaction to wheat.
okay. So
So I mean
wheat is
gluten.
gluten. Okay.
Okay. And then we check this one here and like you are like milk. You cannot do milk. You can't even think about milk. You can't even look at milk.
Yeah. Okay.
Okay.
Milk is out.
Trace amounts, you can't even use that. Okay.
Now,
And
what about rice though? Because I noticed the last time I went off rice and pasta. I don't eat a lot of pasta. Rice, potatoes, pasta. I didn't eat any of those kind of starches because of carbohydrates.
yeah.
Um, but I noticed that I'm okay with rice. So is it okay for me to have rice or should I just stick away from it?
How
Or brown rice?
uh, um like when you look at your lab test, it shows you're not having immunological reactivity to rice or I don't know what potatoes are, but other potatoes right here to potatoes. So it may not cause inflammation for you directly from the food reactivity, but they are high in carbohydrates. And your blood sugar system is not very stable. Like it doesn't have much resiliency. So it could be just the fact of can you handle the carb load of it, not so much the dietary protein issue. Okay. So
Okay.
the ones that are going to be the big ones that are going to cause lots of pain inflammation for you are going to be all gluten sources, milk, and egg.
Surprising about the egg. And then one other thing, I just lost that. Where you go? Soy. So can I have tofu? I know
Yes.
I can have tofu.
I mean, yeah. Let's just start with complete gluten, egg, dairy, and see how you do.
Okay.
And then just see what. So if like 50% of your inflammation goes on, like you can keep restricting foods and go really crazy, which can be hard. I
Yeah.
mean, you're
Yeah.
having a hard enough time with gluten and milk, which are the two big ones.
Yeah.
Let's just have you start with those and really kind of see where it goes from there. And then if we look at your thyroid antibodies are off the charts. You have myelin antibodies. And so whenever you eat those foods and create an inflammatory response, you can have these issues. This is the one I also didn't like you had before, 21 hydroxylase. Those are your adrenal glands. And these, if they continue to cause inflammation there, it just makes your adrenal glands inefficient. That's what makes you so vulnerable to these blood sugar issues. And
And
you may not be able to function normally unless you continue for the rest of your life
how do I get those down by not?
stabilizing sugar levels. Well, you can start with getting off gluten and dairy. Those are the dietary protein triggers. Stabilizing your blood sugar is part of driving your immune system. Anything that triggers your immune system is going to potentially activate these responses. For the most part, the big ones right now we're after is getting you off the dietary protein triggers, which is milk and wheat. Like for real, not like
No, for real. I will.
like
I've been really
gluten
good.
free, and then you have a guilty look, and then you say like, I got most of the
I
cheese
can
off the
see that
eggplant.
the milk, though, I really have noticed progressively writing things down every time I eat anything with dairy in it. My stomach is just, I just don't feel good. So that I've really been trying to stray from. I really have.
So Nicole, one of the key things also is, do you even have capacity to respond? You might not have capacity to respond. So
What does that mean?
you may not respond. Like you made two dietary changes and it's too progressed. The amount of arthritis change you have is so progressed, it's just too much injury for you to recover.
But I don't, I'm hopeful because I know I've done this before and I know how great I felt. And I do feel better. I do feel better since this with the
Yeah, but
sugars.
that was 3 years. That's 2019.
Yeah. No, I
Three
know.
3 years of joint degeneration is not the same joint. So that's like we really need you to seek if you are 100% strict with your diet, does it happen again? Just because it happened 3 years ago doesn't mean it'll happen now. Like it's important for you to just make those connections. Okay. Um. Okay. The other things I just want to make sure the hormonal thing. It sounds like you're going into perimenopause. When I last year we did initial workup on you, you had your FSH, LH measurements, you were in perimenopause, but now as your cycle's getting extended, it sounds like you're going that way. And really what protects you from like having severe menopausal symptoms, maybe as you continue to lose your ovarian pituitary feedback, which can take months and months to do that, is your adrenal glands being able to take the slack and help you recover. So the adrenal glands also can make some estrogen and progesterones and compensate when you lose your normal pituitary ovarian feedback loop from perimenopause, from going into menopause.
Well, I know back in 2019 when I was working with Red River, I know they tried to put me on an adrenal and an adaptogen,
Yeah.
and oh my gosh, it sent me into spiral. I mean, it was awful. I was bleeding.
The supplement you were taking for your blood sugar stability called ProGlycoSP.
Yeah, that works.
That works. That will help support your adrenal
I'll
glands.
order that again today. I meant to order that.
You can do that. Okay. All right. So let's go through. Now, not this one. Let's go back.
My biggest challenge with that one, because I've gotten much better with I was forgetting to take my vitamins all the time. So I got a pill box and I put it right on the counter. And so when I walk by it, I take all my vitamins. The biggest challenge with that one is always like I can remember to take it when I'm taking my rest of my vitamins, but it's always remembering. So I have it on the counter so that I can see to take it before I eat. And I put some in my purse, like you suggested, but then I never remember. And then after I'm like, oh, I forgot to take I forgot to take that. So I don't know. I know you say you want me to take it within a 30-minute window of eating. But is it bad if I take it after that 30-minute window, or it's just not going to do its job?
It'll be fine either way.
Oh, okay. Okay.
It'll just be better, more efficient for you. It'll help you not have much of a roller coaster
But
ride.
then I won't take it if it's like after that half an hour window when I remember. That's the biggest part is my memory. And like I said, I even have Alexa tell me take my vitamins. I can't. My husband reminds me every day to take your vitamins. It's my memory is just I can't remember anything. Well,
Yes,
I can, but it's just like it comes later.
I know. So this was your recent MRI.
Yeah. Oh,
Um,
but about the hormones, I do have an appointment with my gynecologist because I have a lump in one of my breasts and they wanted me to do a 6-month mammogram.
yep.
So I see him for my checkup and my 6-month mammogram, and he's going to do my hormones. He'll do my blood work on my hormones. So I'll send it to you.
Perfect. Okay, no problem. If you end up going to hormones, let me know just so I can be updated on your file. Right, like now, your MRI here, your MRI shows this is what's so silly. Chronic small vessel ischemia changes given the patient's age. You're only 50. You don't see this in 50. I don't know what
Well,
this,
that's what they told me. She said I didn't have to worry about it because we all have that as we age.
we don't all have that. I don't know why again, it's one of the things that's common, but it's not normal. But at 50, that's pretty early. Just like your joint degeneration, like you have, like a lot of 50-year-olds have degeneration. It's not normal. It's still deterioration of the joint, right? Like you have mild generalized, meaning the entire brain volume loss. I don't know what in the world they're thinking. Volume loss at age 50 is not good. To the point they see it on a normal MRI. Normally they have to do something called a neuroquant, where they kind of calculate your volume size compared to people your age group. But if they just look at your MRI findings without calculating to people your age group and just look at it and they see that it's shrinking, it's a bad sign.
Well, and how do I do that? How do I correct that? The gluten and all?
Yeah.
I'm not going to have Alzheimer's or anything, am I?
You could have you're heading towards that, yeah. And if you look at the symptoms,
I don't have
you're not
Alzheimer's.
going to have Alzheimer's. You're going to definitely have cognitive impairment. You have some of it right now. Like if you see the symptom here you filled out recently, medial temporal lobe. These are all the early symptoms of Alzheimer's. So some of these you have as two, meaning 50% of the time. Misplacement of things, difficulty tracing steps.
Oh, I always forget
Always
things.
forgetting where you put items such as keys, phones. That's visual memory. You have
That's
that.
every day.
Typically remembering names and faces. You have 75% of the time.
I know that I see people, I just never remember their names. It's like I can see that somebody's familiar, but I don't know where I saw them from.
It's not
Like
just one. It's like you look at the pattern, the cluster of all these symptoms together. That is not good. Okay.
the memory on being on time. That's probably
Yeah, and
like
then your frontal lobe. This is the main issue: focus, attention, concentration, attention span. Like you have signs of early neurodegenerative disease. You have signs of volume loss. Okay, that's visible without doing specialty testing that normally done to test it, and you have these unhealthy blood vessels throughout your brain.
So if I eat better, will this improve?
Your volume will never come back.
Great.
General volume will never come back. There's some volume in the area of the hippocampus, like your Alzheimer's center. Some studies have shown there's stem cells there, and some of that can come back. The biggest thing that makes that come back is exercise.
Oh, okay.
It's not, and reducing inflammatory foods alone won't do that. Just high amounts of exercise, high amounts of cognitive activity, like really using your brain and moving your body can help some of those improve. But it doesn't happen to 100% of patients. When they do clinical trials and do MRIs with people that go into like interventions to slow these things down, personalized approaches through diet, nutrition, lifestyle, all these things, maybe 10, 20% of the study subjects will have some volume change. The majority don't. So I wouldn't count on it.
Well, I know the one thing I can say is I know I need more exercise. I know I need to be out there doing things because these last couple of months I've just been with Mark and everything. I've been more stationary in the house. So that's why I feel better when I'm outside. I feel better when I'm doing things. And so I've really been making a conscious effort. And that's why I told my husband, I was like, you know what? if I have stuff in our garage and that's what we're doing, I said I'll go out there and I have no excuse not to do it because sometimes I'm like, oh, I don't want to leave the house. I find that I'm getting more and more like that, like where I just don't want to go outside. Not in a mental health way, but just, it's just a lack of effort. And I that's somewhere I've really been pressuring myself to get up, go outside, go. And so, like, when I get off the phone with you, I'll take my dog for a walk. I was going to take her earlier before our meeting, but then the guy came late with the grooming and all. Cognitive. So I haven't been doing the piano, but I bought myself, which I like this stuff. I bought myself this crime book where you have to solve the crimes. And so I've been doing that, where you have to like push the pieces and just little like mental puzzles, little word puzzles and things like that. I've been trying to do that every day. Because I do notice, I just need to notice I'm not as sharp as and I've always been really sharp, especially like with numbers, accounting. I mean, that's what I did. I get frustrated now and that's,
Nicole, it's 100% guaranteed certain it's going to get worse.
yeah,
Just,
if I don't change
just
things. Yeah.
no, even if you change everything, even for everyone, it gets worse with age.
Oh.
Yours is just going to be rapidly fast. It's already way too fast. You're already having way too many symptoms at age 52. Like, so like, this is the time. Like, I don't know. Like you won't have the same joints. You won't have the same brain a year from now or 2 years from now. And whatever volume loss you get of your brain tissue, it's very unlikely to get that back, even if you can start getting on an exercise program. Whatever degree of joint degeneration you lose, you're not going to get that back. Like, you're not going to take a supplement and have that come back. I mean, I don't know. I mean, you definitely are already, I think, a candidate for hip replacement. Just from seeing you walk into an exam, and you were like,
So so for my children and for my young adult children, what could I have done dietary then to prevent
hard to
this?
say. I mean, those are each case is so unique. I wouldn't even know where to start with that. But let's just make the focus on you. As a mother, I think you have this instinct to always think about everyone else except yourself.
Yeah.
So this is your time. You are going the wrong way. You are aging so fast.
Yeah, and I
Your
feel like
joints
I'm
and
aging
brain
fast.
are accelerating with degeneration so fast for your age, and your symptoms clearly show it all over the place. So you have to unwind out of it, and then you're in chronic pain, so you get that inflammation out.
I am in chronic pain. I
Okay,
am with my back.
most important thing. There's a couple things that we got to do. Okay, you definitely have to go. You got to figure this diet thing out. Like, I don't know what it's going to take, but you've got to or get your own food organized.
So should I go back on all AIP?
You could do that if you're comfortable with that. That would be even better.
Got AIP books and I've got those diets. Okay, go back on AIP. I've already started with my exercise. One thing I want to ask you, and I don't know, maybe this isn't your expertise. So they suggested I was going to start doing acupuncture because for the pain in my neck and my lower back, because that's the two areas that hurt my knees, my pain. Which weird. I was talking to my older sister the other day. She has to have her left knee replaced, and she's already had her right hip replaced. And those are the exact my left knee and my right hip. Isn't that weird?
Yeah, we have the same genes, and if you're having the same triggers, you're both going to accelerate quickly.
So I was going to do acupuncture, and then I was going to see a chiropractor. The only reason I canceled on him, I had another appointment, but I'm a little afraid because the last time when I went with River and I loved them, after they adjusted me, that's when I really started having a lot of hip pain. And so I'm scared. I'm scared to do that.
Honestly, you're so inflamed already. It's hard to say how you would respond. Obviously, anything that you do that gives you pain relief and helps you move is ideal, whether that's manipulation, stretching, muscle work, acupuncture. But since you're so inflamed, and anything could make you also worse. That's the key thing.
So I'm going to go on AIP.
Yeah.
I've already started with my exercising. I'm going to try the acupuncture. I'm working on my brain. Now, supplement wise, should there is a supplement, a joint supplement that I have that I haven't, I don't take every day. Should I start taking that every day? I could run and tell you what's in it.
Yeah, let's do it. Nicole, let me go ahead and tell me what's on the supplements. We'll go over this. Go ahead.
Vitamin C.
Yeah.
Magnesium. Doesn't
Yeah.
say magnesium. It says magnesium. Oh, I don't know what this word is. Methyl sulfonylmethylamine, MSM, 500 milligrams.
These are just for joints.
Green lipid muscle,
Uh-huh.
500 milligrams. Chondroitin sulfate, says CS Bioactive,
How much?
300 milligrams.
Okay.
Glycosamine sulfate sodium chloride, 300 milligrams.
Okay.
Hyaluronic acid, 15 milligrams. And then that magnesium, there was 2.5 milligrams, and the vitamin C, there was 38 milligrams.
How many capsules is recommended for you?
Oh, 2.
2. That's not going to reach therapeutic levels. That'd be only like 600 milligrams of cotton sulfate, 600 milligrams of glucose.
It says it does not contain wheat, gluten, yeast, soy, dairy products, fish, peanuts, stress.
Listen, you can take that if you want. I don't think it's going to make any big difference in your pain. You can get your inflammation down first. So you have it, you want to take it. Those types of things do have impacts on helping joints.
Okay.
But to some degree, if the inflammation is greater, then these nutrients can help support the joint, the cartilage and joints. You're not going to even.
Can I go back on my Clearvite? I liked Clearvite.
Go back and Clearvite.
I can go on Clearvite. And then how about magnesium? So I'm bad with magnesium. Everybody said I do have magnesium. I have a powdered magnesium. I used to put it in a drink and drink it with my vitamins. I haven't been doing that. I probably should do that because everybody would say, oh, take your magnesium at night. Well, it would keep me up. Anything that's supposed to calm you down, I had the reverse effect on me. I've tried GABA. I've tried all kinds of things. It just makes me more hyper.
Okay. We have to talk about a few things. So yeah, if you want to take Clearvite, the Pro-Glyco-SP, magnesium, that's fine. Okay. My biggest concern is still phase 1 and phase 2 of your treatment protocol. Okay. So
do I need to take a probiotic? No? Okay.
If you want to, you can. It's like, I don't care.
Okay.
What curious if you're off gluten and dairy and we get you to sleep and we get your blood sugar stable right now. Okay. So phase 1 was stabilized blood sugar levels throughout the day, but this is from a year ago. Stabilize blood sugar levels throughout the day by avoiding fruit and eating meals regularly that are high in protein, fiber, and fats. So we initiated January because you wanted to start for the holidays, January 2022. So this is so it's a year.
Which I think I've done a lot of that.
Yeah, you've done a lot of that. It's good. So the one thing we have to figure out is why you're still waking up in the middle of the night.
Yeah.
Okay. Because that's a big part of this blood sugar system mechanism. And yeah, I know you said you experimented all types of foods and didn't make
I've experimented times a day eating. I do notice what's weird is, I had a glass of wine when my husband and I went out. Well, that was a different time. We went out because we use Wednesday nights are usually our date nights. I had a glass of wine, slept through the night, no problem.
Yeah, that's.
And I thought because I was like, I'm having a glass of wine. I'm going to wake up tonight. Didn't. I've eaten peanuts or something, protein before I go to bed. Still will wake up. I haven't had sugar for days. Still will wake up. I do know I cannot take my vitamins after a certain time in the day because every time I've taken my vitamins after like 4:00 in the afternoon, I wake up no matter what. And I used to wake up around 3:00. Now it's about an hour to an hour, 20 minutes after I fall asleep every night. Well,
so this may not be glycemic related. It could just be called limbic related. You feel, how sensitive are you to sound and light?
I don't notice that. Not sensitive. No.
You're not sensitive at all. It doesn't wake you up at all. You wake up for no reason.
No. Well, that's not true. It's weird. Once I fall asleep, I don't hear anything. Like my husband told me the other day, he said, Nikki, I patted you on the back for like 2 minutes and you didn't wake up. But then if we have an older dog and he has he kicks his legs in the middle of the night. If he does that, it'll wake me up. But I sleep with a fan. Always have since I was a little girl. I
Okay.
have to sleep with a fan. I can't sleep in silence.
You need the white noise. Yeah.
Yeah.
Okay.
So but I wouldn't say it was a sensitive thing. It's weird. It's weird little things that'll wake me up.
So wine's the only thing that's helped you sleep the night.
Well, no, because there's been other times that I've had wine and I've been up all the same thing has happened. That's what it's the predictive, traditionally, if I drink alcohol, that's why I try not to drink it that often. If I drink alcohol, same thing, I'll wake up. But
Nicole, when you
last,
wake up when you wake up in the night, do you have any other associated symptoms like hot flashes or sweating? I know your heart rate
no,
goes.
just my heart rate, just my heart's beating fast. And I feel like I have to, like, even if once my heart slows down and it's at a regular, like 73, um, I have to move. Like I have to fidget. My leg has to move, or I just can't. I'm restless for
Right.
hours. And then I'll fall into a sleep, but then I wake back up and I fall and then I wake back up. I don't fall into a sound sleep for like a couple of hours and then I'm out.
Okay. So I think your adrenal glands may still not be where they need to be. That's, you got to really be able to maintain that cortisol level throughout the night. You're already taking some adrenal support with the ProGlyco SP. We might just need to see what happens when you go off gluten and dairy for the next time we do a follow-up, next few months, and see.
Do you think it could have to do with anything with my thyroid, with me being hyper?
I don't know if you're hyper. Your lab tests clearly don't show that. But if you notice a difference between Armour and Tyrosine, that was noticeable too. That's probably the best indication. Um, that's hard to
I
say.
mean, I feel great in the middle. The thing is, I feel great in the middle of the day. Like I don't have any of these symptoms during the day. It's
So
only at
again,
night.
we're gonna keep your eye on your blood sugar at night, and we're gonna see what happens when your blood sugar levels when you're off when you're back going autoimmune paleo and you're off the inflammatory
Do
loads.
you want me to? I have a one touch sugar poker thing. Do you want me to
Not right
test?
now. Not right now. If we can't figure it out, we might use like a glucose monitor and see how you're stabilizing blood sugar throughout the day. But not right now. Okay.
Okay.
Right now, like you're so clearly reactive to gluten, dairy. You have Hashimoto's. You have so much inflammation. You're still eating those proteins. That's such a obvious thing to look at first. Okay. So I think that's really the main focus right now, is to really.
Okay, so and I'm gonna get I was supposed to have a colonoscopy because I'm over 50. I was supposed to have a colonoscopy 2 weeks ago, but they had we had to change it. I had to take my son to college. So I'm having one on the 27th, I think. And then I see my gynecologist, so I'll get my hormones checked. And I think that's it. Oh, the gastro doctor wanted me to have an ultrasound of my liver.
Great.
So I'm having that too.
Yep, more information the better. So I just want you to let you know, like we're phase one, you're starting to respond in phase one. Phase two is to do a laboratory evaluation to turn autoimmune reactivity to dietary food reactivities.
But didn't I do that?
No, you haven't, because you're still eating milk and dairy and egg.
But I thought that's what those blood tests were.
Yeah, well, once we get the test, the part of that same phase is to follow up.
Oh, stop doing that. Okay.
So we're like phase two, and then phase three was like, okay, you got your blood sugar level stable, you got rid of the inflammatory triggers, and then like which symptoms are still left, and then go from there. Okay. Now, like all your chronic pain, all your chronic inflammation, those and your adaptability through perimenopause, those can all be adrenal and inflammation. So, like, stay consistent with the blood sugar protocol you've been doing. That is really, you're doing an excellent job. Like, don't try to not have like just bananas by itself if you can. If you have a fruit, try to have it be like apple, something that's very high in fiber.
So no bananas?
You can have it. It's just try not to make that a routine thing. Like try to look at fruits on the low glycemic index, like berries and apples. Those are great.
Okay.
And berries and apples have fiber in there, so even though they have a little bit of sugar in there, they're really finding out the fiber, and that kind of negates the actual glycemic load into the system, despite the fact even having some sugar in it, because they're very high in those really good fibers.
Try to stay away from bananas, watermelon, pineapple.
Yeah, the main ones. Yeah.
All the
And
ones.
yeah, and ultimately, you have the thing is like it seems like you have an addictive pattern in the past to fruit. Like
Yeah, I lived on fruit.
yeah, So just like you just have it if you really have to, because once you start eating it, you're going to start craving it more. And we really need that next 3 month window where you're just 100% blood sugar is stable like you are, and you're 100% autoimmune paleo. You're planning your meals. You're not guessing. You're not kind of taking stuff off your food. You're not playing the Russian roulette
The right
game.
food, yeah. And you
And
don't want me taking anything for my adrenals.
yeah, the Pro-Glyco SP will help you support your adrenals.
Oh, and then that cream.
Yep, adrenal stem in the morning.
Cream, yeah.
Yep, and then you're also taking a Clear Bite, and the Clear Bite has lots of lots of nutrients and minerals to help your gut, your your microbiome. There's probiotics in there. There's prebiotics in there.
Oh,
Lots
good. So then
of
I'll just do that and I won't take them because I
yeah.
don't do well with probiotics. They make my stomach bloat
At this
and it
point,
hurts.
whatever you can tolerate is what we're after, and let's get your inflammation down and your blood sugar stable.
And what did you say about the magnesium? No big deal.
Yeah, yeah, it's always great to take. If you can figure out a
Okay.
time of day you can take it, that'd be ideal. So listen,
Okay.
you have to plan your meals.
Okay.
You have to plan your meals. You got to focus
I
on.
might look into a food service. I looked into a food service with Mark for his cancer.
Okay.
But it was just not, he
It's
doesn't
hard
listen.
to
He's
find
stubborn.
those
Like,
that.
I'm stubborn.
Yeah, it's hard. It's hard to find autoimmune paleo food services. That's that's the
Yeah.
thing. A lot
But
of
I
them
have books. I have my books, so I do know what I
plan your
need to.
meals, make a bunch at once, have some stuff ready to go. That's the main difference. People plan their meals and have stuff ready to go. They have their snacks. They have prep meals ready to go that they quickly put together, and they do just planning. They don't.
Well, I'm fearful now. Like now it's just not about wanting to feel well. It's obviously that's what it is, but I'm fearful. I don't want to be, I want to be around for my grandkids. I mean, like you said, I'm 52 years old and I feel like I'm 90 years old and I don't want to be, I don't want to be that. So that really scares me.
I understand, and you should be scared because you're triggering. You have all this inflammation. Your brain volume has changed. You have severe degeneration, especially in your hip and throughout your joints, your whole body. You have autoimmunity to your myelin sheath, to your thyroid. Like these lifestyle things are a really big deal. Like you can have a profound impact on your health and the trajectory of where you go when you just stop driving your immune system. Your labs are off the charts with milk and wheat. Like they're clearly causing severe immune reactions there. And it's just a matter of like you got to do it. Now, I would also tell you you should have hope because it is quite common to have a couple of big lifestyle factor changes dramatically change the progression of where you go. So it's not like don't be hopeless, but
Once I do that, if nothing changes, then I have to be hopeless. But I'm not going to believe that. I believe in positive. I
yeah,
really, I am. I'm believing positive, and I've really tried to. I've always been like a really high-strung, stressed person. Not that you can tell, but I really just try. I've, I mean, it has been. If I had to say the biggest thing I've changed about myself, I go to bed with dishes in the sink now, or if something's a big deal, I don't flip out like I used to. Like, so that part of me has really worked on itself. And it's been a really good change because for so many years I wasn't like that. Like everything had to be perfect and the house had to be clean and everything had to be right. And I'm not like that anymore.
okay. Yeah, that's fantastic. That's
But
good.
you are right. I do worry about everybody else but myself.
So if those emails that you send me, I do read them. I don't know if you noticed I was highlighting key things. I read
Yeah.
those before appointments and I get a good feel of what's going on. And I go through your original file, read that, and then I see the symptoms you have and then start to put things together. So if you can keep those coming to me and let me know what's happening with your pain and inflammation as you go gluten dairy free, that would be really great.
So the only reason I didn't keep them consistent, well, I way back when Mark was going through cancer, I didn't even think about it.
Just do what you can. Just
But it's like if it's the same thing, I feel like he doesn't want to sit here and read the same exact thing.
give me a monthly one.
Yeah, okay, perfect. Because it's just I feel like unless there's something really big going on, I try to just give it to you like every couple weeks when
Now,
something.
listen, when you go gluten dairy free, like you may not notice it until a couple months into it.
Okay.
So don't like go, "Ugh, I'm doing this, it's not working."
No, I won't. No,
Also,
I'm really scared about the brain thing.
also
Like it really
remember,
scared me about the brain thing. So I will do it now.
also remember, trace exposures can keep you in that heightened inflammatory state. So be very careful of those little trace exposures.
Like not taking all the cheese off of my eggplant.
Yeah.
So order the eggplant with no cheese.
Right. Okay.
Don't order the eggplant at all.
Okay, so your focus is gluten, dairy free, keep stabilized blood sugar level, Clearvite, magnesium, and the ProGlyco SP. And let's try to connect in like 3 months, 2 months or 3 months, something around there,
Okay.
and see how you do. It's going to probably take you at least a couple months to really notice the difference of being off those inflammatory foods.
Okay.
So let's say 3 months.
Okay. 3 months.
Okay.
All right.
If
Thank
I
you,
could-
Dr. Grazian. Bye.
I just want to make some comments about Nicole's case management. As you can see, it's been a year. We're still in phase 1, moving on to phase 2, and I think it's important to note this is why it's so critical to write down treatment strategies and the mechanisms and conditions and have a plan from the very beginning, because you can get distracted and go all over the place and chase symptoms and do one thing after another. And a lot of times when you do a workup and sit down and really think about a treatment plan and put it together, that's really when you're going to make your best clinical calls. So I could easily imagine her walking into a practice and having a new set of symptoms every single time and just chasing things and not really having any major success. Now, she really is in bad shape. To see volume loss on an MRI without volumetric assessment, meaning it's not a neuroquant, not doing calculations, and you see mild atrophy there, is a big deal at age 52. And she's had very clear symptoms of cognitive impairment, and her biggest risk right now is, without question, progression to dementia, Alzheimer's, vascular dementia, something along that line, but for sure some neurodegenerative changes. Her joints are severely inflamed. She's really deteriorating. She has accelerated aging. So she definitely has some of that inflammaging processes that are happening. But with inflammaging processes, we have to get rid of the inflammatory triggers first. Someone with Hashimoto's, which has the HLA-DQ1 genotype and who's got neurological antibodies, who still persistently eating milk and wheat proteins, even though they're off the chart, and egg proteins, is probably going to stay inflamed. So we're hoping that she can really do a good job and follow through the guidelines and see how things go. Now, it's easy to get really frustrated with a patient that's taking so long to do follow the protocol, but you have to remember part of that reason just could be her impairment herself. Frontal lobe patterns with low dopamine, which she has, makes it very, very hard to initiate and follow through with tasks. So that, coupled with her significant issues with recall and remembering things because the medial temporal lobe is failing, she really is in this critical window where if she doesn't make a shift, she's going to go down this rapid accelerating cascade pretty quickly. So we'll see how she does in 3 months, and hopefully she can be completely strict with the anti-inflammatory diet that she's going to follow, the autoimmune paleo diet for her. And we hope that it makes a big impact for her and we can start unwinding her. And once those pathways start to unwinding, we can focus more on concepts of trying to reduce her inflammaging and trying to reverse her accelerated inflammatory aging processes. But right now we're still in our removing the acute inflammatory triggers. Thank you.